I'm Dr. Ben Weitz, and this is the Functional Medicine Discussion Group of Santa Monica. Please consider coming to some of our future events. Our next event is September 26th with Dr. Ken Holtorf, and he'll be talking about peptides. This was an extra event. Usually our meetings are on the fourth Thursday of the month, but we wanted to accommodate Dr. Tom to have an opportunity to have him come speak, so we're very excited that he's here. October 28th, Dr. Carrie Jones of Dutch Labs will be coming, and she's an awesome speaker, and she's going to tell us about Dutch testing as a form of analyzing hormones, and it's a convenient way to measure estrogen electrolyte, estrogen metabolites, etc. Please check out my Rational Wellness podcast. It's a weekly podcast, and you can find it on Apple Podcasts or wherever podcasts are. And there's also a video version on YouTube. We've had some great interviews. I just interviewed Dr. Naisha Winters about an integrative approach to cancer. She had tons of really great information. I wanted to mention that we have space in my office where we have 2 rooms available to sublease on Mondays, Wednesdays, and Fridays. We're hoping to potentially bring in an acupuncturist, but we consider somebody else. Many thanks to Metagenics for sponsoring this event and providing the food. I just wanted to mention a Metagenics product. For those of you, I don't know if you use Metagenics products, but I'm sure autoimmune diseases is going to be brought up. This is a great medical food. It's called the Ultra Inflamex 360, and it's awesome for patients with various types of autoimmune diseases, including Crohn's and ulcerative colitis. It has lots of great nutrients and really helpful. So you want to consider that, as well as some of their other products. And everybody here tonight is going to get a special up to 20% off your next order from Metagenics. And if you don't have an account, you can see Kristen or Kaylee in the back of the room and set up an account. So I think we're going to allow questions during the talk, if that's okay. But please keep it, we're going to keep it to 1 or 2, so we don't want to break Tom's train of thought, but we want to have the interaction. So, and if you want to ask a question, raise your hand, and we'll bring you a microphone so everybody can hear. And then I'm very excited that Dr. Tom O'Brien is here. Most of you already know him. He's a doctor of chiropractic. He's an internationally known speaker. He's on the faculty at the Institute of Functional Medicine. He's had the Gluten Summit, the docuseries Betrayal, the Autoimmune Solution, and Not Telling You, which over 3 million people have seen. He's got 2 awesome books out. The Autoimmune Fix was published in 2016, won the National Book Award, and his latest book is You Can Fix Your Brain. Dr. Tom O'Brien.
Thank you. Hello. Sorry I'm late. I witnessed an accident on the 405 right in front of me, and I pulled over, and it was a young mother with 2 kids, and the kids were screaming in the car. And so I just put her kids, because her car was smashed, so I put them in my car, and I put some soft music on and was just talking to Mom while we were waiting for the police. And I took a picture of the guy that caused the accident, so I said, and his license plate. So I said, don't worry, we've got this. You just rest it. You stay with your babies in my car. Right? So, but I'll stay as late as we can. This is being recorded, is that right?
Yes.
Okay, good. So no off-humor jokes. Okay.
It's okay with me.
I'm told that this is not photoshopped. So if that is not photoshopped, and I believe it's not, there are people like this in the world, how many years of training in order to do this? How many years? And we think that, you know, you take a weekend course in autoimmunity and, all right, yeah, I can handle Hashimoto's. You know, lupus, sure, bring it on, bring it on. So the world of autoimmunity, I think everyone here, I'm speaking to the choir, but I hope there's going to be a couple of bullet points that are good takeaways for you to use in your practice out of this tonight. So thanks very much, Dr. Ben, for setting this up. It's very kind of you. And it takes so much work to do this. You know, for the person in a city that coordinates functional forum groups, the time it takes is rarely appreciated. So for all of you, if you can at some point, just say, hey man, how can I help next month? Can I give you 1 hour of my time? 1 hour a year. So if everyone here gave 1 hour a year, that would be 4 or 5 hours for next month's event. So it'll be really smooth, they'll get the speaker there on time, you know, all that will be perfect, right? But we don't know to support the people that are supporting us, like our host tonight, Metagenics. But the work that Ben does here, and people in every city that do functional forums, is unappreciated by most, and expected. When there's a glitch, somebody's going to complain about it, right? And I'm sure you've experienced that. And you know, it happens in every city that we just feel entitled. And so I'm asking that you do a little bit of a paradigm shift about events like this and become responsible for it. And that may be 1 hour a year that you will give to Ben to help put these things on. So that's my little spiel for the night. And thank you, Ben. So can we give him a hand, please? All right, let's get to work. So, some of the things I'm going to talk about can create this. Right? Like, what? And most of what I'll talk about is in the book, The Autoimmune Fix. Very proud of it. It's 30-some years of work. How long did it take to write the book? 30 years. But most of what I'll talk about is in there tonight. So I'd like to start with this. And this is an analogy I've used with patients for years. Mrs. Patient, when you get a diagnosis, you came in because you've been diagnosed with rheumatoid arthritis, okay? Or MS, or migraines, or Lyme's disease, whatever the diagnosis is. It's like you've fallen over a waterfall and you've crashed into the pond below. And you swim up to the surface and, oh God, thank God I'm alive. And you're swimming in the pond of diabetes. Or you're swimming in the pond of rheumatoid. But it's really hard to stay afloat because the waterfall keeps falling into the pond, so the water's really turbulent. You're living the lifestyle that caused the disease. You're living in the pond of diabetes, or whatever the diagnosis is, but you're in this pond. And the waterfall keeps falling in. You keep living the lifestyle that's caused you to be in this pond. So everybody wants a life jacket. Everyone wants to stay afloat in the pond of high blood pressure, or diabetes, or rheumatoid. It doesn't matter what the diagnosis is. Everyone's trained to go for the life jacket, right? And I'm speaking to the choir. We all know this, but this may be an analogy that you'll use with your patients, or it might fire you up to think of another analogy to help them understand where you're trying to take them. Life jackets are really important. You got high blood pressure, you take the medication. Don't be silly. But let's see if we can reduce the need for the medication. So when you go back to your cardiologist that prescribed the medication, you say, hey, would you monitor me over the next few months? I'm like changing my diet, taking a couple of vitamins, I'm exercising, and I'd like to reduce the need for this much medication. And every doctor would support that if a patient's rational, not fanatical, right? So I call it life jacket medicine. Everyone comes in wanting life jacket medicine. And that's great, but as soon as you're stable in the water, you don't stay in the pond. You don't live the lifestyle that's caused the problem. Swim over to the side of the pond, get out of the water. Walk up the hill, walk back up the river to figure out what fell in the river that carried you downstream and you fell over the waterfall into the pond of diabetes. And I know I'm speaking to the choir, but it's those kinds of visuals that will help your patient stay with you when you're, there's a checklist here, Mrs. Patient. Let's check here first, and then we'll check here, and then we'll check this. And then they're with you for the exploration. Because the vast majority of what's coming in is degenerative diseases, right? I mean, if it's trauma, okay, go to the ER. But aside from that, it's lifestyle, the vast majority of the time, that's created or contributed intensely to whatever they're coming to you with. Does that make sense? Okay. So premise number one, we have to move our focus out of the platform of life jacket medicine. Whether the life jacket is pharmaceutical medicine or nutraceutical medicine, we have to get away from thinking, you got this, I'll give you that. You got this, I'll give you that. Right? So we all know that in the majority of cases, having a gene does not dictate a person's going to develop the associated condition. It dictates a person is vulnerable to developing the condition. The influence of environmental exposure and the risk of developing autoimmune diseases is paramount. In fact, environment, more than genetics, shapes immune function. Autoimmune diseases are an immune activation. So the question is, what happened upstream that triggered your immune system trying to protect you? Mrs. Patient, your immune system's the armed forces in your body. There's an Army, an Air Force, a Marines, a Coast Guard, a Navy. And they kind of smile, and then you say IgA, IgG, IgE, IgM. How many of you think, sorry, I don't mean to phrase it that way, but we can't do a 90-food IgG panel and tell people what to eat or not eat. IgG is the Army. So if the Army is not activated, what about the Air Force? What about IgE? What about the Marines? What about IgA? Well, I don't know, I didn't check. Well, you can't tell a person it's okay to eat a food because you did an IgG test. All you can say is, you do not have an IgG reaction. Paradigm shift. We have to ask the right questions to get comprehensive information. Of course you want to test for sensitivities, of course you do. And of course you don't do just IgG or just IgA. That's it. I was taught that in 1980. This is now 40 years later, embarrassing to say. And we still think that way, and most of our laboratories are still offering panels that way because we'll pay for the panels, keeping the laboratories in business. You have to express what it is you want. So with your labs, hi, I want an IgA, IgG, IgM panel. Well, we don't do that. I know you don't, and I'm going to go to a lab that does. Because it's archaic to only check IgG. It's useful, very useful, but it's archaic. So when you test IgA for celiac disease, IgA, transcontaminase deaminated gliadin, but how many people look for total IgA levels when you run that test? Because if they have an IgA deficiency, it's going to come back negative. And about 20 to 30%, depending on the paper, of the people you see have an IgA deficiency. So if you're running just the standard IgA test for celiac disease, you're going to miss 20% of them because they don't have an IgA reaction that you can identify. They've got IgG or IgM, compensating because IgA is depleted. Does that make sense? Mm-hmm. So you want to talk to your labs about demanding more. They don't want to do it. Do you know how many hundreds of thousands of dollars it will cost them to expand their services? They don't want to do it. And change their report forms. They don't want to do it. But it's a business. And you're the customers. And if you don't just start politely saying to the representatives, hey, I need more comprehensive immunoglobulin testing here. Hi, Hyla. My friend, Dr. Hyla Cass. Yes. So if you don't ask for more, they're not going to give you more. So please partake in expanding services for your patients. Please give this guy 1 hour a year. 1 hour a year. You know, it's those little baby steps that we take. Well, I won't go off on tangent because I have too many slides. Genetics accounts for about 30% of all autoimmune diseases, and the rest is environmental. What fell over the waterfall? What is it? Is it dietary? Is it toxic chemicals? Is it infections? Driving up here, I was trying to calm down, you know, just wanting to rush, but you can't rush when it's bumper to bumper on the 5 or the 405, you can't rush. So I'm listening to Mark Hyman interview Jay Lombard. It got me more worked up. It was a great interview. Jay's talking about infections as a primary trigger for neurological degenerative diseases. And they were just talking about study after study after study. It's a nice interview. Mark's got the doctor's pharmacy, F-A-R-M, pharmacy. And he does nice interviews in there. But infections are a major one. We'll talk more about that tonight. But let's talk about this gene thing, and arguably the most talked about one in clinical practice, MTHFR. And there are weekend workshops on MTHFR, which is really great to learn more about the impact of if this thing gets activated. What's your immediate thought if you discover a patient's homozygous for MTHFR? What is, most people in the room, what do you think? Give them folic acid, right? Right? Because, oh, they've got MTHFR. Well, so what? Is the gene activated or not? When folic acid intake is sufficient, homozygotes for MTHFR appear to be protected against colon cancer and acute lymphatic leukemia. And fetuses bearing this genotype have an augmented survival. There's a reason for MTHFR. There's a reason for it in some people. So when you have, if you're homozygous or heterozygous, it doesn't mean you've got a problem. It means, Mrs. Patient, if you pull on a chain, it breaks at the weakest link. It's at one end, the middle, the other end. It's your heart, your brain, your liver, your kidneys. Wherever your genetic weak link is, that's where the chain's going to break. Don't pull on the chain, right? So what does that mean, don't pull on the chain? You give people these analogies, and you say, don't pull on the chain. Well, what does that mean, Doc? Well, it's an inflammatory situation. Diseases are inflammatory at the cellular level. So let's stop throwing gasoline on the fire. Let's calm down the inflammation. Well, how do I do that? Well, that's what we have to find out. Where is the gasoline coming from for you? What happened upstream that carried you downriver and over the waterfall into the pond of diabetes? Let's find out what it is. So with these analogies, as you start wrestling with some of these, by the way, how do you get good at doing analogies with patients? You go in the bathroom, close the door so no one can see you, stand in front of the mirror, and you do intestinal permeability. Mrs. Patient, the intestines are a tube from the mouth to the other end, about 20, 25 feet long, kind of winds around in the middle there. And the inside of the tube is lined with cheesecloth. So only really small molecules can get through. And then I go through my whole thing, and I sometimes say this 20 times a week, 30 times a week. Mrs. Patient, your intestines are a tube, starts at the mouth, goes to the other end, about 20, 25 feet long, winds around in the center there. You know, I do these cute little things because I'm half Italian. And I have fun with it, right? But how do you communicate the visuals that you want to give to patients? You stand in front of a mirror in the bathroom and you look in the mirror. Mrs. Patient, the intestines are too tall. Oh, my hair. Oh, my God. Because all those kinds of things are going to come up, right? Your brain's going to get caught, and you have to get past all that to be able to say a comprehensive elevator statement, elevator speech, you know, the 30-second elevator speech. What do you do in 30 seconds like this, right? You have to be able to give that elevator speech Monday morning to the first patient and Friday afternoon at the end of the week. And that person on Friday afternoon deserves the same focused communication as the person on Monday morning. You know the best time to get surgery? Tuesday mornings. Least side effects. Why? Because there's no more hangover from the weekend, and they're not dragging on Monday, and they're fresh for Tuesday morning. So, same on Monday morning, same on Friday afternoon. And the only way you develop that is by standing in front of a mirror and doing it. Again and again and again. The conversion of fig glue for mineralglutamic acid. 2, glutamic acid requires tetrahydrofolic acid as a coenzyme. A method for determining folate deficiency is based on this reaction. The amount of fig glue excreted paralleled the red cell folate level in both the anemic and non-anemic folate deficient patients. Fig glue excretion, like the red cell folate level, appeared to be a satisfactory index of tissue folate stores. Someone has MTHFR, you do an organic acids profile and check their fig glue. If their fig glue is elevated, they're not utilizing folic acid very well. And so they need folic acid. But if they don't have an elevated fig glue, I can't find any other signs of a problem, I'm not going to give them folic acid because they've got MTHFR. That's like if you've got a BRCA1, have a bilateral breast removal. Well, I've got BRCA1. Well, so what? Just monitor and don't turn that gene on. Well, I've got ApoE4. Oh, congratulations. I love ApoE4 patients. You know why? Because I read to them from the book of life. Mrs. Patient, you have ApoE4. That's not really desirable, but that's the deck of cards you got. So here's what has to happen. Every biomarker possible that identifies inflammation in your brain, we're going to check. And any that are elevated, we need to get them down. So depending on the results, it can take 6 months to a year, but we'll get them down. There's a test out now called the NeuralZoomer Plus. Some of you may know of it from Vibrant.
Yes.
It's the most comprehensive test for brain inflammation. 48 different markers, antibodies that they look for, with 97 to 99% sensitivity, 98 to 100% specificity. How's that? Say, whoa! Ask your labs about their sensitivity and specificity. They won't know. The sales reps don't know, because the tests are 30 plus years old, most of them. Okay, we won't go there. Measurement of fig glue levels is a functional indicator of folate utilization versus the static measure of RBC folate levels. So you're looking to see, is this stuff being utilized well? Do I have enough of the raw material here, or am I depleted and so my fig glue level's going up? It's a very simple biomarker that you can use. And in a typical organic acid report, they give an explanation what glutamic acid is. So, and this is a typical report, and there it is. It should be less than 9. This one was at 46.
Welcome to the Doctor's Pharmacy. That's FARMAC, a place for conversations that matter. I'm Dr. Mark Hyman. I'm here.
It's best to wait until afterwards, before listening to some of the other interviews. Yes?
Quick question. When you are doing the fig glue test, if somebody has been on a methylated folate or folic acid, how long can you wait, or should you wait before you test?
My understanding is half-life of B vitamins in the blood is somewhere between 4 and 7 days. That's my understanding, but I'm not an expert in that. We don't treat based on a gene. We act to investigate if we need to treat or not based upon a gene. Does that make sense to you? So every patient should be checked for ApoE4, every single one of them for their ApoE level. Why? Because there's such a high risk of developing Alzheimer's if you're an ApoE4. Doesn't mean you're going to get Alzheimer's, it means that's the weak link in your chain. So Mrs. Patient, so all of my ApoE4 patients, they get panels done about once every 2 years just to make sure they're still okay and there's no biomarkers of inflammation in their brain right now. We must go deeper and ask the question, what activates the gene? Why is this happening? Anyone in this room ever hear Dr. George Goodhart speak? Yeah, I'm dating myself. There's 2 or 3 of us, 4 of us. Yeah, the old guys say, yeah, I'll raise my hand. Yeah, right. One of the things that he would do all the time, and most common talks were at the Marriott at the Metropolitan Airport in Detroit. The 10-session series with George were always there. He's the founder of applied kinesiology, the muscle testing that many people do. And he would always do this. He would get up there and be talking, and he'd just lift his arm up, lift his leg up, and why, doctor? And he'd slam the ground. Why does the patient have what they have? And he did this animated thing with his foot to really knock it into us. And it worked. It really worked. Why? Why is this happening? Why do they have what they have? Of course you want to give them a life jacket so they feel better right away, or they're not going to stay with you. But you don't stop there. Once they're safe in the pond of whatever their diagnosis is, Mrs. Patient, we need to figure out why this has happened to you, and how are we going to reduce your need for this life jacket. So in celiac disease, 90 to 95% of them carry HLA-DQ2, the remainder HLA-DQ8. 50% of people with non-celiac gluten sensitivity also carry the gene. So the gene doesn't mean you're going to get celiac disease. So why is it that if about a third of the population has the genes for celiac, only 1 to 4% get celiac? Well, wait, you've got the gene. Well, okay, but why only 1 to 4%, depending on what country you're talking about, develop celiac disease? 30 to 35% of the population have the genes for it. Why? Loss of oral tolerance. That's the big kahuna in autoimmune diseases. Loss of tolerance. Your immune system will no longer tolerate whatever the offending agent is that's come in there, and now it's fighting to protect you. Your immune system gets activated trying to protect you. And I keep saying that to patients again and again, trying to protect you, so you don't want to suppress the immune system. You want to find out, why is the immune system activated trying to protect you? As Mark would say, Mark Hyman, I made his interview the first one in betrayal, because he said, the really thing you have to do is find out, why is the immune system so pissed off? Why is it upset? And that's what we have to look for when we're dealing with autoimmune diseases, is why. Why is it happening? The complex interplay of multiple genetic and environmental factors will determine the development of celiac and any other autoimmune disease. 25% of the population in Europe is positive for DQ2. 50% also have DQ8. The vast majority of these people will never develop celiac. Positive HLA tests will not increase the likelihood for disease very much. And that's a concept about genetics. Arguably, the most studied genetic disease is celiac. There's over 20,000 papers on it, and it's the only one, slam dunk, we know what the trigger is. Sweet, slam dunk. But why does only a small percentage of the people with the genetic vulnerability, why is it such a small percentage that get the disease? Loss of tolerance. Bottom line, loss of tolerance. So we're going to talk more about that. Here's a case study. 42-year-old guy came in, mild cognitive impairment and hepatic encephalopathy at 42. And his multiple symptom questionnaire was 153. And he thought he was fine. Yeah, I'm fine. I'm not remembering stuff very well, and I'm not sleeping well. Doc says my liver enzymes or something, but I'm fine. I'm fine. But his MSQ was 153. It should be below 10. Up to 20, okay, maybe you're okay. But his was way out there. And where was it coming from? Well, the vast majority of symptom patterns that he reported were in his mind and in his emotions. So where am I going to look, going back upstream, to figure out why is this guy got hepatic encephalopathy and why is his brain going down on him? So here is the Weitz zoomer that we did on him. This is the most comprehensive test in the world today, looking for a sensitivity to wheat. There's nothing like this anywhere else. Once again, 97 to 99% sensitivity, 98 to 100% specificity. There's never been anything like this. So I'm just going to take a moment on that, because everyone needs to know this. I call it the 30-30 rule. 30 years ago, it took a room, 30 by 30, floor-to-ceiling computers to generate the computing power of this phone. Right? We never would have guessed this 30 years ago, that I can tell you in a few seconds, if I remember which, oh, there it is. Yeah, I can tell you the particulate matter in the air in Chicago right now. It's in the green. It's at 40 parts. So it's at 40. But, or Delhi, or San Antonio, Texas, whatever, I've got a program here. We never could have imagined that 30 years ago. The same is true in laboratory medicine. You do the research on the last test that you ordered today in practice, whatever the test was. Give your staff the task tomorrow morning. Find out when was that test first developed. You'll find many of the tests you're using are 20, 30 years old. Doesn't mean they're wrong, but technology has improved. You now can get 97 to 99% sensitivity, 98 to 100% specificity every single time. And this technology can do 6,000 antigens in one blood draw. Did you get what I just said? 6,000 antigens in one blood draw. Mayo Clinic's written they published 2 papers on this. They call it a new era in laboratory medicine. You know, I'll talk about some of the tests a little bit later again, but it's like, wake up. You know, we all need to know that these are available to us, and why would we use anything that's less accurate and less sensitive when we know these tests are now available and they're competitively priced? The lab is pretty aggressive, wanting to be the top lab in the country right now. So this young man, he had elevated antibodies to zonulin and actin, that's the intestinal permeability markers that are included in the wheat zoomer. Wheat germ agglutinins, that's the lectin in wheat. So you get a positive wheat germ agglutinin back, you have to check all the lectins. Some of you have read the plant paradox. Some of you found that recommendation that nobody should eat lectins. I completely disagree with that. I think no one should eat lectins if the immune system's fighting lectins. If your immune system says you got a problem with lectins, then don't eat lectins until your immune system calms down, right? So there's a lectin zoomer, there's a wheat zoomer. They've got about 10 or 12 or more zoomers. There's a corn zoomer, because there's many different protein peptides of poorly digested corn that your immune system may react to. The wheat zoomer is 26 different peptides of poorly digested wheat. Most laboratories look at alpha-gliadin, and they call it a gluten test. Or we'll check you for gluten, or we'll check you for wheat. And all they look at is alpha-gliadin. Very important, critically important, but it's only one of 62 immunogenic peptides of poorly digested wheat. There are 62 that your immune system can fight. Why are we only checking one? Well, that's what the laboratory offers. Well, now you know there's another laboratory. So it's Vibrant. This is not CMEs tonight, so I can say that. So it's called Vibrant Wellness. So look them up and see what you think about them. So he had a number of peptides to poorly digested wheat that he was sensitive to. And they give you an easy reading graph there to see it on. This test is called the NeuroZoomer Plus. It's 48 markers of inflammation in the brain. 48. What do you think, how much credibility do you give to one marker of inflammation in the brain being elevated? A lot, right? A lot. So if 47 markers come back negative and one comes back positive with 97 to 99% sensitivity, 98 to 100% specificity, are you going to pay attention to that one marker? I hear it all the time. Docs, make this crap up. Oh, this isn't too bad. You've only got 3 that are elevated. It only takes 1, right? We just happen to have a test that's got 48 markers that they can check for inflammation in the brain. We've only had 2 come back negative so far on this test. Why? Because 1 out of 3, the Alzheimer's Association came out this year and said 1 out of 3 elders will die with dementia. So that means this side of the room from here over will die with dementia. So I'm going to stand over here for the rest of the evening. I want to, yeah, this side. But that's how bad the statistics are now. 1 out of 3. Yes?
So if you know that your patient's IgG, IgA, IgM are low, high, would this not be an accurate test?
I missed the question.
So if you test the patient's total IgG, IgA, and IgM in general, their total, and they are below lab values or highlighted in the IgM, would this test not be accurate?
Oh, if they're high, it'll still be accurate. High means your immune system's working really hard.
Right.
But if they're low, depleted, no. And
gotta get
you
them up.
you have to take that into consideration as you interpret the test.
Yes.
So this test looks at blood-brain barrier disruption, peripheral neuropathy, brain autoimmunity, brain inflammation, herpes simplex 1. There's over 246 studies on herpes simplex 1 and Alzheimer's. Just Google herpes and Alzheimer's. You'll see the studies. All of your patients that break out in cold sores, that means they've got an active infection in their head right now. Just read a couple of the studies about herpes and you see the beta amyloid plaque. You see that amyloid is an immune response trying to protect you from something that got into the brain. It's like, what? Amyloid's not bad for you. It's part of our defense mechanisms. Excessive amyloid that's been plaqued off is bad for you. So the question is, why is there plaque? Why is the amyloid in there? What's it fighting? And so you run the panels and you see they have bacterial infections. Jay Lombard in the interview I was just talking about, he's all on C. diff. And he's found every single neurological degenerative disease patient he sees, he finds C. diff on them. Every one of them. I mean, that's pretty startling. Okay. So my working diagnosis for this guy, mild cognitive impairment, secondary to a wheat-related disorder, and there may have been many other foods, but it didn't matter at this point because now I've got his attention, contributing to a breach of the blood-brain barrier. I call that B4, a breach of the blood-brain barrier. Mrs. Patient, you've heard of leaky gut? Yeah. Well, you got leaky brain. So it's called B4. That's the geek term, breach of the blood-brain barrier. We'll just call it B4. And then we'll talk about how do you fix B4. Fueling severe brain inflammation. That was my working diagnosis. Well, what's the ICD on that? There is no ICD. This is a working diagnosis, not an insurance diagnosis. So recommendations, wheat-free, dairy-free, sugar-free, lots of root and fermented vegetables, root vegetables every day as prebiotics, 9 cups of vegetables per day before any carbohydrates of any type, 8 different colors in the food, Deanna Minnick's concept of the rainbow diet, ½ ounce of silica-rich water per pound body weight per day, because silica binds and pulls out aluminum. So I want them to have mineral water that's high in silica. Identify environmental triggers fueling the inflammatory cascade. He had mold in his house. He didn't know, but I had him do a mold test because he had mold metabolites and urine tests we ran on him. My brain master class is 74 videos. I wanted him to watch every single video to understand what he's up against in stopping. I said, you know, Mr. Patient, you know how Boulder rolls downhill? He said, yeah. I said, you're crashing. You're going downhill. You're just trying and stop a boulder that's running downhill? No, it ain't easy. And he's like really silent at this point. It ain't easy. Okay. I said, so this boulder's coming downhill. Do you think that I can do this and you're going to be great in a month? No. Okay, good, you're not. It's going to take a while. So what we have to do is we have to taper that downward slope, parallel it, and then get it to rise. When you give them visuals that you work with and that you relate to, they get it. That this is a roller coaster ride. And I want more good days than bad days, but you'll still have some bad days for a while. And if you talk to them straight, they're with you. They'll stay with you if they believe that you've got a rational game plan that you're implementing here. Infrared saunas titrated up with niacin, because you know niacin does flushing, basal flushing. So I want them to flush. I want to flush out those toxins. So I slowly titrate them up little by little. And monitor aerobic exercise, always wearing a pulse monitor, or on the wrist, but always wearing a pulse monitor, always. And most people are startled when they put a pulse monitor on. They say, well, this can't be right, this is too slow. No, you're in your aerobic range now. Everything else you have been doing is anaerobic, causing more stress hormones. Right? Okay. For the testing, we did a heavy metals, a provocative challenge, Cyrex array 11, Cyrex array 12, and he had some pathogens. He didn't have any chemical sensitivities. He had mold and a couple other pathogens. The smell test, oh, that's right, I wanted to show you guys the smell test. Let me grab something here. Here we go. Okay. So, I've talked to a couple of neurologists about that. They've agreed. And what I understand is that the only nerves in the body that go directly back into the brain without any filters, without any interruption, are the nerves, the olfactory nerves. Directly back into the hippocampus. Directly. Right back there. Why? It was a life-saving mechanism. Our ancestors, they grab some food, it's the first thing they do. Or they're walking down the trail and they smell saber-toothed tiger. They better just, like, really quick, get out of there. Right? It's a life-saving mechanism. When you have hyposmia, when you're losing your sense of smell, there are 14 studies identifying hyposmia as a biomarker of early Alzheimer's. 14 studies on this. So I read one and I said, what? What? I read a study in Science that said if you have hyposmia, you're 70 years old or older, you have hyposmia, you have a 35% increased risk of mortality within 5 years compared to someone your age that doesn't have hyposmia. You die of something within 5 years. What? So I looked this up. I found University of Pennsylvania is where most of the research has been done on this. So Richard Doty runs that there. So I called him and I said, hi, I'd like to see Dr. Doty. I told him, hi, this is Dr. Tom O'Brien with the Institute of Functional Medicine. He said, what kind of medicine? I said, functional medicine. He said, what's that? And I started explaining. He said, oh, that's very cool. I said, yeah, it's really the coolest. It's really great. It's really great. So this smell thing, is this real? He said, yeah, this is right on the money. So we put together, and this has a 97% reproducibility factor. We put together you'll see it, I'm going to pass it around, it's the UPSIT, University of Pennsylvania Smell Identification Test. And you, like a lottery ticket, you scratch the bottom here, and is that tomato, menthol, strawberry, or licorice? And then you mark down the answer. Then the next one, you scratch it, is it cherry, honey, lime, or whiskey? And just circle which ones you think they are. And then after you've done all 12, here's the answers. And you look and see. If you score 9 or more correct, you're fine. You score 8 or less correct, you got a problem. 14 different papers say it's a biomarker of early Alzheimer's. So I'm going to pass these around, one on each side of the room. You guys just scratch it and smell it, and do a couple of them. Do a couple, and then as you pass around, the smell will last for people. But don't look at the answers on the back page. Right? Oh, where do you get them? The dr.com/smell-test. So for patients, it's the dr.com/smell. And for patients, they're $47. For practitioners, if you go to smell-test, that's your page, and they're $27 each in packs of 10. And it's a 97% reproducible biomarker of hippocampal inflammation. That's cool. It's very cool. And there are 5 studies on my website. When you go there, and just download the studies, read the studies, and then see for yourself, wow, this is cool, because it's a biomarker. And you can change. The fastest growing stem cells, the fastest generating stem cells in the body are the epithelium of the nasal cavity. And thoracic surgeons are taking epithelial cells from the nasal cavity and putting them into the spine of paraplegics and getting really good results now. I know, because This area is the fastest regenerating stem cell producing cells in our body. Why? To save our lives from saber-toothed tigers. We have the same body as our ancestors thousands of years ago. We just don't use our sense of smell, but it's the same. Isn't it cool? The smell thing is really cool. I like it a lot. So what did I do for this guy? Charcoal binders every day, suck up toxins, gluten sensitivity packs. There are some packs that we use. There's 22 nutrients and 6 pills, but it's 1 pack. Mrs. Patient, can you take 1 pack a day? Yeah, I can take a pack. Good, there's 6 pills, but it's 1 pack a day. So I minimize it for them. Because nobody's going to want to open 6 bottles every day, let alone 22 bottles every day. So,
are the enzymes or what?
Say again?
Are the enzymes? Or?
No, there's no enzymes in those packs. I'll talk about enzymes. But there are 22 different nutrients, all are shown in one way or another to assist with reducing inflammation in the gut. The focus is on leaky gut. The gluten sensitivity packs are our primary component in our protocol for leaky gut, these packs. And then colostrum, that's the other part of our protocol for intestinal permeability is gluten sensitivity packs and colostrum. It's really simple. So I have used colostrum every day in a smoothie and take the GS packs. Well, what about if they have a sensitivity to dairy? Mrs. Patient, we just found out you've got a sensitivity to dairy, all right? We just found out. It's too bad. You're done with pizza. You know, that's how it is. But I'd like you to try the colostrum for 2 months. Why? Because it's Mother Nature's way of turning on more genes in your gut to heal intestinal permeability than anything else. Every newborn baby has intestinal permeability, every one of them. And colostrum turns the genes on, shut those borders down now. We've got to start to regenerate here, get tighter cells, right? So we give them colostrum gluten sensitivity packs as the base.
Which colostrum do you like?
Dr. Andrew Keach wrote a book, Peptide Immunotherapy. Andrew's a personal friend. He was born and raised on a dairy farm in New Zealand, and they learned really early, you don't give those newborn calves colostrum, they die. Milk won't work. And then he learned that when adults were sick, they took colostrum, and kids were sick, they took colostrum, they got better. So he devoted his life to wanting to produce the best colostrum in the world. Andrew formed APS Bio Group, and so he got a PhD at Oxford in mechanical and chemical engineering. I said, Andrew, PhD at Oxford, way to go, man. Congratulations, that's really something to be proud of. But mechanical engineering, what? What? Well, Tom, I knew that I was going to make the best colostrum in the world. No one was doing it, so I was going to have to learn how to build the equipment to do it.
Wow.
That's a farmer talking, right? So he built his $18 million facility, and he started producing the best colostrum in the world. 3 countries that I know of in Africa license it as the treatment of choice that they pay for from a diagnosis of HIV. They pay for this colostrum. And it's the exact colostrum I use. It's from Numedica. They're the distributor for APS Bio Group. And there are many others that buy APS Bio Group colostrum, and they package it under another name. I just don't know what those companies are. Okay, that's the smell identification test. He scored 7 on that test. I said, man, you got a problem. And I set people up. You know, before I talk about test results, I said, Mrs. Patient, my favorite patients are the ones who say, I've been to Mayo and they don't know what's wrong. I said, that's great. Oh, congratulations. And they look at me like I'm a nutcase, right? And I purposely do it like that. Say, congratulations. That means that you don't have a disease, because if you had a disease, Mayo Clinic would find it. You've got dysfunction. Let's see what's not functioning right. So the tests we're going to do are different. You've already done the disease test. We're going to do the functional test. Oh, okay. And then they're with you, right? So the next visit, they come back, and it's always the same thing. And I have to keep a straight face, but I just love the moment. So, you know, people are always nervous when they're about to hear test results, right? I notice I am also when I do that. But I say, well, your test results are back. And they're looking kind of neutral to scared. And I say, good news, you're a mess. Look at all these things that are wrong here. You got this and this and this. This is great. And they're looking at me and saying, because these are all correctable. These are functional problems. So this is going to take 3 to 6 months. This will take a couple of weeks. This one's going to take maybe a year, but this is good. If I couldn't find anything, then you really have a problem, right? So it's great that I can find all this stuff because we can fix this. Now we'll recheck these tests in 6 months. We'll recheck this one in a year. Just save your money. Don't test again beforehand because we won't be sure that we've gotten the results. You'll start feeling better fairly soon. The rule in my office has always been 3 weeks. I don't care if you've got stage 4 cancer. 3 weeks, and you better be feeling better to some degree. I don't know where, but either your energy's up, you're sleeping a little better, your pain's down every once in a while, then it comes back strong, the seizures are there but not as often. Whatever it is, you should see we're making a difference within 3 weeks. If not, then I'm going to have to do the Dr. Jones on you. And they look at me. David Jones is a president emeritus of IFM. And David always talks about this. You know, he comes into the room and he says, hi, how's your thing? They say, I'm no better. And he says that he looks at the file. And you've been doing, yes, doc, I've been doing everything you said, I'm no better. So he says, would you excuse me for a minute, please? Closes the file, walks out of the room, closes the door, takes a deep breath, opens the door, goes back in. Hi, I'm Dr. Smith. Dr. Jones asked me to come in because he doesn't have a clue what's wrong here. So let's start at the beginning. And he goes right back to the beginning. Tell me about your birth process. What do you know about birth? How was it for your mother? Were there any antibiotics at birth? And he just goes right back to the beginning. He missed something. If they're not better in 3 weeks, we missed something. Somewhere you missed it. They're not going to be fixed. But I've not had the experience where if I'm onto something and they're complying, they should notice some benefit within 3 weeks. Okay, pearls on stabilizing the blood-brain barrier. Oh, I threw this in here for you. So, anti-inflammatory nutraceuticals like aged garlic, alpha-lipoic acid, niacin, nicotinamide, they all help to heal blood-brain barriers. And what I'm going to do, my team's not prepared for this, they're going to hate me, but we're going to do this. I'm going to give you all of the studies that I've got here tonight. And I'll give you the slides. I'll give you all the slides. I think every speaker should do that in every conference. I'm up here for the microbiome conference that starts in a day or two. And every speaker should give all of the studies that they're quoting in their presentation to every attendee. So in this one, there's about 40 studies, and I think 28 or 30 of them, they were free to me, they're free to you. And if they weren't free to me, I can't give them to you, so I'm giving you the link to the abstract. So I'm either going to give you all the studies, and I think there's 28 or 30 of them, or the abstracts. Okay? Because I really want you to be challenged by this and look into it a little further. So, more pearls on stabilizing the blood-brain barrier. These are studies on the right column here. These are just the references for the studies on vitamin C and E together, helping to heal B4. Vitamin E by itself, melatonin, alpha-lipoic acid, aged garlic extract, Bicolin, caffeine. They all will help to stabilize a blood-brain barrier. Sodium butyrate is really important that you have enough butyric acid in the gut. Critically important for many, many reasons, but here's another one. Because it heals blood-brain barrier permeability when you have enough butyric acid in your gut. Lithium, low-dose lithium is excellent if you have B4. Bicolin has been widely used as a traditional herbal medicine. It increases brain-derived neurotrophic factor. This herb does. So it helps to heal the blood-brain barrier. And this product, full disclosure, I am the medical director of this company. It's called Sunhorse Energy. This product we launched at IFM's annual conference 2 years ago, and it blew everybody away. is really such a great product. It's called Fog Cutter. And there are some studies going on right now at UCSD on Fog Cutter with cognitive impairment. And they're blown away by what they're finding. So this is just a great product. And on our website, we say, do the Fog Cutter Challenge, and you will win. So what's the Fog Cutter Challenge? Read some of the research that I put on the site about Fog Cutter, but without taking it ahead of time to test your attention and memory. Then read after taking 3 pumps of Fog Cutter, wait 5 minutes, and then read it again and see what your retention is. In 5 minutes, you'll see it right away. It's a great product. So I gave that to him, and I had him doing 3 pumps 3 or 4 times a day. In 6 months, his retest showed no cognitive impairment whatsoever, and his liver enzymes were down to normal within 9 months to a year. Okay, it's frequently stated that it takes an average of 17 years for research to reach clinical practice. This is the average, not the exception. So when they first published that cholesterol may have something to do with cardiovascular disease, maybe, it was 17 years before the guy down the street was testing cholesterol levels. 17 years. Same with gluten, same with the studies on gluten. There is resistance to new ideas sometimes. There are many relevant paradigm shifts that we could talk about that need to occur in our world today, but for the sake of this talk tonight about autoimmunity, this one is #1 in my opinion. Now this is in the Museum of Science in Florence. It's Galileo's finger. And Galileo bequeathed that all of his inventions could be on display for all of posterity, as long as they also displayed his finger. It happened to be his middle finger. It's Galileo's last message to the church, because he was suppressed again and again and again. There's a couple of books on Amazon. Just type in Galileo's finger, and if you read about it, there's one, the 10 great ideas of science. How many hundreds of thousands of people suffered because Galileo couldn't get his ideas out to the world because he was suppressed, right? So he was saying, hey, the Earth is not the center of the universe. The Earth goes around the sun. But the whole world thought the world was flat, right? No, it's round, and it goes around the sun. No, of course not, it's flat. Everybody knew it was flat, right? He presented a paradigm shift. And he was ostracized for it over his entire life, for his ideas and thinking outside the box. So here comes what likely will be a paradigm shift for some of you, although I'm speaking to the choir. This is Maureen Leonard. She's at Harvard. She's on Fasano's team at Harvard. And she did a review of the literature on celiac disease and non-celiac gluten sensitivity. This is a really important takeaway. Previous studies have shown that gliadin in wheat can cause immediate and transient increase in gut permeability. This process takes place in all individuals who eat wheat. You get intestinal permeability when you eat wheat. Now, what individuals does this happen in? I'm sorry? One more time? Thank you. Well, I'm fine when I eat wheat. I'm fine. We'll put that on your tombstone. He was fine. So, wait a minute. So is the world round or is the world flat? Are you fine with wheat or you're not? It's one way or the other. So, we knew back in 2006 that gliadin activates zonulin signaling, resulting in an immediate reduction of the intestinal barrier function and passage of gliadin into the subepithelial compartment. I've been teaching that since my first gluten course in 2008, sponsored by Metagenics. Who's the Metagenics rep here? Thank you so very much. I did 26 8-hour presentations around the world that year in 2008. That's where we met, right? So thanks to Metagenics, I was able to get that message out to a large group. And in 2015, Fasano and Holland and their team at Harvard published this one. Increased intestinal permeability after gliding exposure occurs in how many? How many in this room? All. Everyone. And this is from gastroenterology. This is Detlef Chupin at Harvard, and some docs, gastroenterologists from Germany, and some from King's College in London. And they did confocal endomicroscopy. Confocal endomicroscopy is kind of like an electron microscope down in the gut, taking pictures down there. And they took 36 patients who qualified moderate to severe irritable bowel syndrome, refractory irritable bowel syndrome, meaning for at least a year. A year of treatment at Harvard, nothing was working. Or a year of treatment at King's College in London, nothing was working. And they thought, maybe food has something to do with this. Could that be irritating the bowel? That's not how they expressed it, but that's what they thought. So they took these patients and they injected a white dye into a vein that they knew anatomically was going to go right past the gut and through the veins in the gut, back up into the torso. And they wanted to see if the white dye leaked into the intestines when the intestines were exposed to wheat. And here is the white dye in the epithelial lining of the gut. And here is when there's a bursting out that's occurring. And here now the dye is out in the lumen of the intestines. Now they said, you can see it here, although a physiological process, the onset of large numbers of breaks is pathology. That's leaky gut, right? So,
Leaky.
my power just died. I forgot to plug in the battery.
I didn't do it this time.
Do we have a power cord up here? Or? It'll take a minute to charge, so there's a video I'm going to show you that's very cool to see. Yeah, questions are good.
Okay, so I've noticed this in myself. It's just my clients.
Wait, hang on.
I've noticed this in myself and a couple of my clients, where mold exposure has caused autoimmunity, and then when the exposure has been removed and detox has happened, the autoimmunity still sticks around, just to a lesser degree, but it just doesn't go away. Do you have any thoughts about that?
Tolerance. It's tolerance. Tolerance. What is your immune system fighting? So, did you identify antibodies to mold or urinary metabolites?
Urinary metabolites.
Okay, and you rechecked and they were gone.
Yes.
Okay, good. Did you look for antibodies?
No.
Okay, so if the immune system is still fighting, what's it fighting? That's always the question. What's it fighting? It could be more than mold. They could have bacterial infections. They can have food sensitivities. They can have SIBO, causing permeability and more bacteria flying in.
But it started with the mold.
That was the straw that broke the camel's back.
So in other words, the mold is not the issue, but it's still all the other usual suspects, basically.
Gluten is not the issue in celiacs. It's just the straw that breaks the camel's back. I've never said that before. That's kind of blasphemous, isn't it? Right? Actually, I'm going to put that. I'm going to put that online. I'll tell my team gluten is not the cause of celiac. It's the straw that breaks the camel's back. See if I have power now. Okay, here we go. Now, this is 5 minutes of still shots that you'll see in 48 seconds. Watch what happens now. So the white dye is traveling through the blood vessels, but you're going to see that it's going to start to have some leakage. Like here, here's some leakage starting to show. Not too bad, but more coming to the surface of the cells. Now you see there's lots of bursting happening here. This is after wheat was introduced into the gut. That's intestinal permeability. Within 5 minutes of that stuff dropping into the small intestine.
Wow.
Isn't that cool to see? There's nothing like seeing it, right? That's why when you want to talk to your patients, I'm not kidding. Close the bathroom door, look in the mirror, and get past how you look and really talk and develop the skill set. Because they need to see what you just saw in your eyes. They need to hear from you that you know what you're talking about. And you know, if you got a hangover because you had too many beers on Thursday night and it's Friday morning, or you know, if you have your cycle and you got cramps, or they don't care about any of that. You got to get past your own situation in life, you know, your kids, crazy kids, or whatever it is, and you got to be there for them. They're here for you. So you've got to get that wrapped down so that you can deliver the message, whatever your message is, you can deliver it consistently the same way.
Question?
Yeah.
Did they, was the study done with other items?
Yes. Wheat, soy, yeast, and dairy.
That's what they used, or those were the ones that we?
They did every 36 patients, they did 4 times with each of them. 5 times. They did a control, and then they did wheat, then they did soy, then they did dairy, then they did yeast.
And all of them leaked, or just the wheat?
They all leaked, but to different substances, but within 5 minutes. When it comes out of the stomach into the small intestine, if it's at all antigenic, that's where the dendritic cells are. The dendritic cells that say, we got a problem here. You activate the dendritic cells, you activate a systemic immune response. So all of the gluten digesting enzymes out there, you ask your sales reps, show me the data on how long they take to work in the human gut. Show me the data. And there are really good enzymes out there. Most of them are somewhere between 3 and 6 hours.
Oh.
So they'll do a great job of protecting the large intestine. But you will already have activated the systemic immune response from the exposure as soon as it drops out of the stomach into the small intestine. Because that's why celiac disease is a disease of the proximal part of the small intestine. Because that's where the dendritic cells stand in guard, that if anything comes in, they fire their chemical bullet to attack it immediately. You have the same body as your ancestor thousands of years ago, right? And what did our ancestors have to fight? Why is 70% of the immune system in the gut? What did the ancestors have to fight that required the vast majority of our immune system that is activated on a daily basis? In one day, it's activated more than your entire systemic immune system gets activated in a lifetime. There's more immune activity in one day in the gut than in your bloodstream for a lifetime. Why? What did our ancestors have to protect us from? Bugs, parasites, viruses, molds, fungus, and bacteria. That was it. So how does your immune system respond to toxic peptides of wheat? Bug, parasite, virus, mold, fungus, or bacteria. That's the only way it can respond to any antigen that comes in. That's the hard wiring that we have. Bug, parasite, virus, mold, fungus, or bacteria. That's it. There's nothing else. We've never thought of it that way. But your body's fighting bugs when you have food sensitivities. Your body's acting as if you've got bacteria, a bacterial infection. Dendritic cells, you activate toll-like receptor 4, here comes interferon gamma, that's the innate immune response when they can't do the job, and here comes IL-1 beta, and here comes NF-kappa B, and when that's not enough, then here come the antibodies, the backup, the big guns, right? But it's all in the proximal part of the small intestine. So you eat wheat, or you try to protect yourself from wheat, by taking enzymes that take 3 to 6 hours to work, you still get the systemic problems, but you don't get the large intestine problems anymore. Right? And so I'll talk about enzymes in a little while. And the researcher said the reactions and changes had a clearly defined sequence in every patient. The entire sequence of changes happened within 5 minutes and clearly was visible to all present. So what they're saying is, holy cow, Batman! But that's geek language for holy cow, Batman. Yes?
Do you know if there's been any studies done on raw milk versus pasteurized? 'Cause it would be
The raw milk versus pasteurized debate. It's a good one. However, once you have memory B cells to dairy, once you have elevated antibodies to dairy, the peptides of raw milk have similar amino acid sequences enough to likely activate an immune response. So this is what you do for people that are into raw milk. This is patient, no dairy whatsoever, until we get these antibodies down to normal. And when the antibodies are down to normal, can I have dairy? Well, I don't know. But if you want your raw milk thing, if you want to do that, go ahead, have some raw milk for a while, then we'll wait a month and we'll check again. If the antibodies come back, the answer is no. So it's never your opinion. You don't know. Well, can I have raw milk? Well, raw milk is healthier for you. There's not homogenized and it's not pasteurized, so it's healthier for you. You're making it up. You guys are making that crap up. We all do that, because we use our best level of knowledge and then we make clinical decisions on that. But you've got technology available to you. Your immune system is there to protect you. It's the armed forces. Don't ever make that stuff up. Say to the patient, well, I don't know, Mrs. Patient, but here's a protocol by which we can find out. Because your immune system, trying to protect you, will tell us if it needs to stay activated or not. But I don't know, I can't afford the test. Okay, just a minute. And in their file, I write, patient refuses to do the test for financial reasons. Would you sign this, please? Well, why? Well, I'm not responsible. I mean, if you're not going to do what I recommend, I'll do my best to help you, but I want a record in case you die. I don't want your family coming after me. No, okay, I'll do the test, Okay, good. You're not their friend. You're here to save their life. Do you guys know about the 6th extinction? If you don't, just Google the 6th extinction tonight. The National Academy of Science is publishing now. There's no technology to save the planet. 50 years from now, we won't be here. They're publishing that now. And this is not a local community college. This is the National Academy of Science. It's like, wake up! We all need, I just took those studies out for tonight, because there was too much I wanted to talk to you about. But we have to wake up. You're not their friend. Everybody wants to be nice. Be kind. Don't be nice. Nice means, well, I don't want to hurt anybody's feelings. I don't want to make them upset. So you be nice. Kind is authenticity with compassion. World of difference. If you know, and you look them in the eye, and you've been in front of the mirror in your bathroom enough that you can deliver the message clearly to them. They're an ApoE4, and I need to read to you from the Book of Life. And then you explain to them what ApoE4 is, and what their risks are. And here's the numbers, here's the percentages. But all these people that got Alzheimer's with ApoE4, they kept eating ding-dongs and ho-hos. They didn't know. You know. I'll give you the life jacket for now, but we're going back upstream to figure out why you fell in this pond of cognitive impairment. You guys get this? Don't be nice. Okay. An immediate and transient increase in gut permeability takes place in all individuals who ingest wheat. Everyone. Well, I feel fine when I eat it. Well, we'll put that on your tombstone. Because there are so many other toxins we're exposed to now all the time. We're so overwhelmed. Do you want to know if you have a problem with wheat? Do the wheat zoomer. 97 to 99% sensitivity, 98 to 100% specificity. Everyone in this room, if you don't do a wheat zoomer, now that you know those numbers, okay. Okay, I've done my job. You now know. And whether you feel it or not, well, how come I can eat the wheat in Italy, but I can't eat the wheat here? Because the Italians call it a loss of well-being. All of the symptoms in the body outside the gut from wheat sensitivity is a loss of well-being. Migraines, seizures, heart arrhythmias, joint pain, osteoporosis, doesn't matter. That's all loss of well-being. The gut symptoms are caused by the FODMAPs in wheat. The loss of well-being is caused by the activated immune response causing systemic inflammation, wherever your genetic weak link is. Does that make sense to you? So how come I can eat the wheat in Europe? Because it's lower in FODMAPs. So you don't get the bloating, so you think you're fine because you don't feel bad after you eat the pizza there. But you still activate the immune system going after your cerebellum, if that's the weak link in your chain, or going after your thyroid, if that's the weak link in your chain. You're still going to get all the damage eating the wheat over there. You just don't feel it. The lucky ones are the ones that get gut symptoms. The lucky ones. Well, you gut symptoms when I'm in Europe. Well, yeah, I have to explain that to you. Okay, so pick a partner and answer this question. If you read these studies and confirm this is hard science of human physiology, what would the significance of these numbers be in your practice? All right, we'll take a minute. Go.
What number?
What would the significance of these numbers about how many people are sensitive to wheat?
Everyone.
Everyone. So what's the significance of that in your practice? All right, let's do it this way. How many people know or suspect that you may have a sensitivity to wheat? Show of hands, please. Hold them high for a minute. Look around the room. Look around the room. Okay, thank you. Put your hands down. This is not a talk to a celiac group. This is a talk to well-educated Southern California healthcare practitioners. And so you know. This is your practice. Why aren't you treating people with this frequency for this condition? Now, how many of you know or suspect if you get an inadvertent exposure to wheat, it seems to affect your brain? Show of hands. Come on. Look around the room. Hold them high for a minute, please. Look around the room. That's your practice. That's your practice. That's the brain's most common system of the body impacted by sensitivity to wheat. Why? Because 20% of the blood's there at any one time, and you have systemic inflammation, your brain's on fire. And when you have systemic inflammation, you get a breach of the blood-brain barrier, you get B4, you get the leaky brain, and so now these macromolecules get into the brain, and the glial cells, you have 4 different immune systems in your body, right? You've got the gut, the liver, the systemic blood, and the brain. And the glial cells in the brain are standing guard. They're just standing there dormant all the time unless something gets into the brain that shouldn't be there. And then these guys fire bazookas to protect the brain. Great. But what if you've got B4? So macromolecules are coming in all day, every day. All this collateral damage that's going on in your brain. What does that look like? It looks like the neural zoomer plus with 8, 10, 12, 15 positive different brain tissues that you've got antibodies to. That's what it looks like. And now you have a test with 97 and 99% sensitivity, 98 to 100% specificity to identify it. Who's not going to do the neural zoomer? Neural zoomer plus, that's the big one, the neural zoomer plus. Any of you, yeah, wheat affects my brain. Well, you better find out if your brain's on fire right now, because this side of the room is going to die with dementia. That's why I'm hanging out over here more, right? But it's the long-term, day in, day out, loss of tolerance, systemic inflammation, wherever the weak link is in your chain, antibodies are produced, going after your thyroid, going after your cerebellum, going after your joints, going after your kidneys. Wherever your genetic weak link is, that's where a wheat sensitivity will manifest itself. Or a streptococcal sensitivity, wherever it's going to manifest itself. And the studies show it's commonly associated with rheumatoid. So if you have elevated antibodies of strep, you easily can develop collagen antibodies. because the pattern of the amino acid sequence is similar enough. You make antibodies to strep, or to Proteus, or to Klebsiella. Those three have been shown to cross-react, and you make antibodies to collagen in your joints. You get rheumatoid, and it's a bacterial infection that set it up. So it's not just wheat, it's the environmental triggers. Remember there were three? There was foods, there was the environment, and I don't remember what the third was. It was what? Infections, okay. Yeah, bacteria, right? Okay, so this is, I put this one in here about wheat. It's like, you know, enough already. Enough. You guys, we're all like this, you know, to some degree, but 94% of the room raised their hand. Yeah, I'm sensitive to it, yeah? When's the last time you had it? Well, this morning. Yeah. Because we think it's not a big deal because we're not throwing up sick when we eat it. Okay, do wheat Zoomer and do Neural Zoomer Plus. If they come back negative, enjoy yourself. You've not lost oral tolerance. Just check every year or two, because you will. There's so many other toxins in our world. Your immune system's fighting mold, and fighting Klebsiella, and fighting phthalates. And 346 women, pregnant, urine collection, 8th month of pregnancy. Measured 5 phthalates. There are hundreds of phthalates, but they measured 5. One of them was BPA of the 5. They categorized the results into quartiles. The lowest quartile, the next one, the third one, and the highest quartile. They followed the offspring of these pregnancies, and when the children turned 7 years old, they did Wechsler IQ tests on all these kids. There's not much in medicine that you ever see this all or every. This was every. That's why it's so startling. Every child whose mother was in the highest quartile of phthalates in urine in pregnancy compared to the children whose mothers were in the lowest quartile, every child in the highest quartile, their IQs were 7 points lower. 7 points. 1 point lower is noticeable. 7 points is the difference between a kid working really hard, getting straight A's, and a kid working really hard, getting straight C's. They just don't have the neural network. It never developed because phthalates inhibit neurogenesis. And moms that had the highest level of phthalates had the highest level of brain growth suppression in their offspring. Wake up. Where are phthalates? Nail polish. So every one of you now know. You put nail polish on in 3 to 5 minutes, the phthalates are in your bloodstream.
There is no evidence that the amount of phthalates that leach into the bloodstream are toxic to humans.
And that's how they get away with that crap. There is no evidence that the amount that leaches into your bloodstream is toxic to humans. No evidence whatsoever. But give me 25 years of these tiny amounts that accumulate. You've all heard of endocrine disrupting chemicals, right? Endocrine disruptors. Why are they endocrine disruptors? Because they bind onto the receptor sites of estrogen and testosterone. And then you get hormone dysfunction. Right? So phthalates. So every one of you need to look online. Phthalate-free nail polish. And order a couple of them. Or I'm sure around here you're going to find places that have it. You know, or nail salons that are proud to say they're organic and phthalate-free. And you find one you like and just throw the other stuff out. Don't even use it. Well, you just use it up. Oh, I'm just going to poison myself for a few more months here until I use it all up.
There are phthalates in almost all of our skincare products.
Yeah, exactly. There's phthalates in the skincare products. There's phthalates in this room that we're breathing, in the dust, because there's phthalates in these ceiling tiles. There's phthalates in plastic blinds. And they outgas. So when you do an evaluation of the house dust in your house, and you'll see what your level of phthalates are that you're breathing. And formaldehyde. And all the other crap that we're exposed to. Why is autoimmunity so rampant now? This is why, because your immune system, trying to protect you, is fighting all this toxic stuff that we're... The Journal Pediatrics. You get published in the Journal Pediatrics, that's a score, right? #1 journal in the English language for kids' health, right? They published a policy statement. What's a policy statement? That's not an author. That's a message from the board for the American Academy of Pediatrics. Do you get the significance of what a policy statement is? And they talked about the Toxic Substance Control Act. of 1976 that still is the regulating legislation at the federal level for chemicals introduced into our environment. And they said it failed miserably to protect children. In 40 years, it's only regulated 5 chemicals. In 40 years, or 5 classes of chemicals in 40 years, because the lobbyists paid off our legislators who passed this legislation with no teeth. There is no guidelines on what chemicals can be introduced into our environment. There are no guidelines. And it's 247 pounds of toxic, 247 pounds of chemicals produced or imported into the United States per person per day. Every single day. 247 pounds. So if there's 100 people here tonight, that would be 24,000 pounds of toxic chemicals, not toxic, of chemicals every day being manufactured and imported into the U.S. Every day. You've all heard that newborns have at least 200 chemicals in their bloodstream that aren't supposed to be there. Many of them are neurotoxins. Why do you think autism's going up so high? No, it's not vaccination. Don't ever say vaccinations cause autism. You sound like a nutcase. If that were true, every child would get autism from vaccinations. But it's very rational to say vaccinations may cause autism if they take you over the edge. And in Betrayal, how many of you saw Betrayal? Anyone? Oh, just a couple. Oh gosh. Oh my gosh. You guys got to go to betrayal.com. You see me interview Professor Yehuda Schoenfeld, who, from Tel Aviv, who 28 of the PhD students that got their PhDs under him, there are many more, but 28 of them chair departments of immunology in med schools and hospitals around the world. They're his students. This is the godfather of autoimmunity. And his book had just come out, Vaccines and Autoimmunity. I said, Professor, and I knew the questions to ask him. And he said, we're very much in favor of vaccinations. They have saved millions of lives. However, if a child carries the gene HLA-DRB1, and about a third of the population, European descent, carries that gene, they are at high risk of having a sensitivity reaction to the adjuvant in the vaccine. That's aluminum. Don't ever say vaccines cause autism. Vaccines may cause autism. It's very rational. You guys get this?
Yes.
Genetic vulnerability, environmental trigger, takes them over the edge. Why do I recommend silica-rich water? Because it pulls aluminum out. What's part of the protocol for every child that's going to get a vaccination? Parents decided to do that. They're drinking silica-rich water for weeks beforehand. They're having a little cuppy every day, once or twice a day, a little bit of water, and for them it's, that's quite a bit. Silica-rich, Fiji is, Fiji. It's the easiest way. The brain is your yellow canary in the coal mine. So we all know what a yellow canary is, and in the human body it's the brain. So you've seen autism going up, and Stephanie Seneff at MIT tells us within the next 15 years or so it's going to be 1 in 2. 1 child in 2 will be on the autism spectrum. So this just came out from the Alzheimer's Association earlier this year. 1 in 3 seniors dies with Alzheimer's or another dementia. 1 in 3. So you guys over here, you really want to do these tests that I was talking about. And between 2000 and 2015, there's been a 1% decline in deaths from breast cancer, 7% decline in prostate cancer deaths, 11% in heart disease, 16% in strokes, 55% HIV, and 123% increase in Alzheimer's, deaths from Alzheimer's. The yellow canary in the coal mine. How many of you raised your hand when I said you have an inadvertent exposure that seems to affect your brain? Wake up. 1 in 3 are going down, and by the time you admit or accept that you've got dementia, you're toast. That was a joke. So do the Wheat Zoomer and do the Neural Zoomer Plus, just to find out where you are. Yeah.
Can I circle back to a second for the conversation about autism? It strikes a chord because my daughter has autism. How, a lot of you people here are functional doctors, I do not. How do you advise your patients on how to approach the vaccine?
Mrs. Patient, the topic of vaccines for your children is very personal. There's lots of intensity on this topic. I recommend that you get as much information as you're comfortable with, and then make a decision as a couple for your family. And we will help prepare you for this, whatever decision you make. And where do I get the information, Doc? Go to Dr. Sherry Tenpenny's site. Tenpenny. And she's thousands of articles there. And she just gives you the whole article and a summary, so you can read the summary, but she gives you the article, so you can see about that. Okay, here's one for you. This is the projected increase between 2018 and 2025 in Alzheimer's dementia prevalence by state. So the lightest color is 13 to 20%. The darkest color is 40 to 46%. California is over here in the 20 to 26% increase in the next 7 years. But this is state by state. Where are there more toxins? Where is there more insult coming in? Where do we lose tolerance quicker? This is what we're up against. We have to wake up. How many of you have a patient or a friend whose life was saved in a fire because they were sleeping under flame retardant bedding?
Right? In flame retardant clothing.
And flame retardant clothing. How many of you had a patient whose life was saved? But they're all breathing this crap because it outgasses. And it's just more accumulation in your body. More accumulation. It's a very tough, we've never had this world before. And now you all know, you've heard something about 5G and the dangers. It's just, we're already so highly inflamed, active immune systems trying to protect us. Here comes 5G, it's gonna just go boom and hit us hard, really hard. Because our threshold for electromagnetic pollution is reduced. Because our threshold for environmental chemical pollution is reduced. Because our threshold for food sensitivities is reduced. Because the whole load is so high, overwhelming our systems, we're on stress mode, immune protection mode all the time. If anyone in this room comes back negative on a Wheat Zoomer and a Neural Zoomer Plus, if you come back negative and you have adequate immunoglobulin function, I will pay for your test. That's how confident I am that you're going to go, what? And then you read, because the other labs are going to say, oh, well, the technology is research only. No, read the papers from Mayo Clinic, 97 to 99% sensitivity, 98 to 100% specificity. Is the world round or is the world flat? Anyone in this room that's a healthcare practitioner that doesn't jump on checking these tests out for themselves, all I can say is shame on you. It's cutting edge technology with the highest sensitivity and specificity ever of any test. Published by Mayo. I trust those guys in stuff like this. What do we do? Not this. Not this. Not this. How do you avoid the neutralizing effects of...
Please, the library will be closing in 30 minutes. The second floor restrooms will be closing in 15 minutes. If you need a library card, please go to the customer services desk immediately. Thank you.
Okay. How do you avoid the overwhelm effect? I'll just get right to it. There was this guy in 1984 in Australia, a microbiologist named Barry Marshall. Barry Marshall said, you know, I think that sometimes ulcers are caused by bacteria. And they said, what a nutcase this guy is. He was a graduate student, I think, at the time, and he was ostracized, made fun of, called a nutcase. So what did he do? He did an endoscopy, took a picture of the healthy pink tissue of his stomach. Then he drank a beaker of Helicobacter pylori. He drank a beaker, waited a couple of weeks until he was as sick as could be. Did another endoscopy, took a picture of his ulcerated stomach. Then he took the antibiotics to kill the Helicobacter, waited a few more weeks, took another endoscopy, took a picture of the healthy pink tissue of his stomach. Then he published it. Then everybody knew he was in that case. But he proved sometimes ulcers are caused by a bacterial infection. And the World Health Organization sent a message to every medical society in the world, pick up on this. Because number one cancer in the world is stomach cancer, caused by a Helicobacter infection. So pick up on these early signs of a Helicobacter infection. So Barry Marshall did this. 21 years later, the guy wins the Nobel Prize in physiology. And the Nobel Committee said, who with tenacity and a prepared mind challenged prevailing dogma. You have to have tenacity in order to overcome the odds against you right now. This side of the room needs tenacity, a lot of tenacity, because they're toast.
We're not getting this.
This, right? They need tenacity. What does that mean? And my book that came out last September called You Can Fix Your Brain, #1 in 7 categories on Amazon for brain functions. Like, yes, yes. Right now it's #1 in Korea, the #1 book in Korea right now. Yes, it's great, it's great. The subtitle of the book is just 1 hour a week to the best memory, productivity, and sleep you've ever had. Why do it's not a cutesy title. It's the only way to be successful. How many people in the room have the time now available to change your life? You've got the time to change your life tomorrow. Really? Oh, that's marvelous. One person does. Get rid of the phthalates in the air that you're breathing. Right? Find out all your food sensitivities, get them out of there. Develop an eating style that's healthy for you. Find out how bad your microbiome is and rebuild it. I propose people get overwhelmed and they throw the baby out with the bathwater. Or they try something for a while, it works, and then they stop doing it. Humans are the only species on the planet. You find something that works and then you stop doing it. We're the only ones that do that, right? Just 1 hour a week, Mrs. Patient, 1 hour a week. Every Tuesday night after dinner, every Sunday after services, whenever it is. But every week, this is your time to do research to protect you and your family. So 1 week, you're going to go back to the book and you're going to open the part up about plastic storage containers. And you're going to say, now what was that? Well, oh yeah, mileskimball.com, okay? You go there, you'll go to Amazon, say, oh, I like those more. And you're going to order the glass containers. And what, like, you need 3 round ones and a couple square ones and one for the pies. You order them, you pay through credit card, hit send. You're done. It took an hour. You're done. But never in your life will you poison your family again by putting leftover chicken in Tupperware. Because it leaches phthalates into the food in the refrigerator. The next day there's phthalates in the food. And you'll never poison your family again because you took an hour to order glass storage containers. Give the Tupperware to your husband to store nails in the garage. They're really good for that, right? But next week, you're going to learn more about air filtration systems in your house. And the next week, you're going to learn about water filtration systems. And the next week, you're going to learn about cotton clothing or cotton sheets. And every week, you just take 1 hour to learn one more thing. 1 hour a week. That's it. In 6 months, you've got this. That is the only way I know to get somebody out of the pond that they're in and create a new life for themselves within 6 months or a year. It's the only way I know to do it, is to tell them, be kind, take your time. Take your time, just 1 hour a week, Mrs. Patient, because it's too overwhelming other than that. So tenacity, that's 1 hour every week, and a prepared mind. So for us, you know, we have so many resources available to us now. Green Med Info, Mind Valley, my books, Hyman's books. There's so many great books out there. You know, whatever your passion is that you want to get involved with, but you need to learn. That's how you prepare your mind to challenge. No, the world is not flat. No, wheat's not okay for you. No, every human gets intestinal permeability every time they eat wheat. It's transient until you cross the line of tolerance and you've altered your microbiome so much that now you have an inflammatory microbiome and you've got constant intestinal permeability. Now it's not transient anymore. Now you got leaky gut. By the way, 78% of the prebiotic in the Western diet comes from wheat. Take wheat out of their diet. Give them gluten-free. And I'm not going to get to the studies tonight, but in the Journal of the American Medical Association, they did 33,000. They looked at 33,000 endoscopies and biopsies. This is in Sweden. They found 13,000 and some celiacs. 3,700 that had increased IELs, intraepithelial lymphocytes. And 13,000 that had positive blood work but negative endoscopy. So 3 categories that they looked at, 33,000 total endoscopies. If a person's diagnosed with celiac disease, that means villus atrophy, they're diagnosed with celiac disease, they have a 39% increased risk of mortality across the board. 39%. Well, wait, they've been diagnosed, so they're gluten-free. Right. They still have a 39% increased mortality rate. This is the largest study done on mortality in celiac disease, published in JAMA. If they had positive blood work, but negative histology, that's called latent celiac disease, they had a 35% increased mortality. 35. So it doesn't matter if the endoscopy is positive or not, in terms of lifelong projections. It doesn't matter at all. You got positive blood work, you got a problem. Now you got a problem. But here's the kicker. The ones that were negative to blood work, negative to endoscopy, they just had increased inflammation, IELs, intraepithelial lymphocytes, 72% increased mortality. Double the celiacs. Why? Nobody checks for inflammation in the gut and nobody treats inflammation in the gut. That's why you do the wheat zoomer and you look at intestinal permeability, because now you know you got inflammation in the gut that you have to do something about. These numbers are startling. And what? And this is the largest study ever done on mortality in celiac disease, published in the Journal of the American Medical Association. Do you think it's a valid study? 33,000 biopsies, 13,000 celiacs. It's like, wake up. You put people on a gluten-free diet, so you take wheat out of their diet, you take away their 78% of their prebiotics. When you do that, what happens to them? They get sick 3 months, 6 months down the road because you change their microbiome. The arabinoxylans in wheat, the prebiotics in wheat, are feeding the probiotics in the gut. Everything about wheat is not a problem. So the arabinoxylans are feeding your probiotics. Your probiotics are completely dependent on the arabinoxylans for 78% of the food that they eat. Take that out of there in one day, where you're going gluten-free now, and you tell them it's okay to eat the gluten-free crap, which is just white paste. There's no nutrient value to any of the gluten-free foods unless they're consciously prepared. Quinoa, amaranth, and some grains, things like that. There's no B, it's not enriched. The flour's not enriched. There's no B vitamins added to it, where wheat flour is enriched, right? So put them on gluten-free products because they're healthy for you. Oh, it's healthy. Why? I can eat that gluten-free muffin. It's healthy. No, it's not. It's just not pure poison for you. But it's just white paste, right? So put them on a gluten-free diet, take out 78% of their prebiotics, and watch what happens to their microbiome. I can't get to any of the studies tonight. There's a substance, some of you may have heard of, TMAO. Some people are familiar with that. It's a metabolite, TMA, trimethylamine, is a metabolite produced by the microbiota in the gut when you eat foods that are high in carnitine or choline, eggs, meat. So this whole thing about meat, red meat being dangerous for you and increasing cardiovascular disease, it's not the saturated fats. They've proven that beyond a shadow of a doubt. Hazen at Cleveland Clinic proved that. It's not the saturated fats in red meat. What is it? It's the carnitine. Why? Well, because the carnitine gets metabolized by abnormal microbiota in your gut, producing trimethylamine. Trimethylamine goes to the liver, gets converted into trimethylamine oxidase, I think it is. I think it's oxidase, I'm not sure about that. But it's TMAO, which is the most high-risk marker of atherosclerosis of any marker. Almost double the risk factor of high LDL cholesterol. You have elevated TMAO, you got a problem. Right now, you got a problem. Right now. And TMA is produced by an abnormal microbiome. And then the liver converts it to TMAO. So give them a gluten-free diet, take out 78% of their prebiotics, completely alter their microbiome without using the products of Mthfr or other spore-based products. I personally use spore-based probiotics. So you take out their prebiotics, don't give them any, I put them on a gluten-free diet. There, see that, put them on gluten-free. What else you do? Nothing. Here's a statistic from the Journal of the American Medical Association. Remember I said 39% increased mortality if you're celiac, 35% if you have positive blood work, and 72% if you have inflammation in your gut? Well, diagnosed celiacs have an 86% increased risk of mortality in the first year after diagnosis from a cardiovascular event. 86% compared to the other 33,000 biopsied people. 86% increased risk of mortality in the first year from a cardiovascular incident. 3.8-fold increased risk of mortality in the first year after diagnosis from cancer. In the first year after diagnosis. How is that possible? Well, this is how it's possible. You take away the prebiotic, you give them dysbiosis, a few months down the road they're producing TMAO at high levels, and here comes a cardiovascular incident. Does that make sense to you? That's what I'm presenting this weekend at the Microbiome Congress. I just threw it in here for you guys. Isn't it cool?
Can you test for TMAO?
Yeah, you can test for TMAO. LabCorp does it, and Cleveland Clinic heart tests do it. The highest risk marker for a fatal cardiovascular incident. TMAO levels being elevated.
But I think that test is being misused as a reason why we shouldn't eat, say, meat. Because the argument is that now choline and carnitine are bad for us. But the problem...
No. The only people that had cardiovascular incidents, according to Cleveland Clinic, they've done a lot of research on this, were those that had elevated TMAO levels. Not the carnitine. It's the abnormal microbiome converting the carnitine into TMA.
Right, but some people are saying as a result of that, nobody should eat carnitine or choline, so we shouldn't eat meat.
That's nonsense.
We should be vegetarian.
Yeah, that's nonsense. What you have to do is check your microbiome.
Exactly.
And see if you have elevated TMAO levels. Every cardiovascular risk test you take better include TMAO levels now. And when they come back elevated...
Please, the library will be closing in 15 minutes. The second floor restrooms are now closed. Thank you.
TMAO levels should be checked on every cardiovascular test. Yes?
What prebiotic do you recommend to replace the wheat when you take people?
Mthfr has an entire protocol with prebiotics and probiotics that I personally like. Our host tonight may have some prebiotics, and they'll be in the back at the end of the meeting to answer those questions. So I don't want to say, Metagenesis is great, they've got great products, I just don't know the answers.
Can you use nuts as prebiotic?
Can you use nuts as prebiotic? Mrs. Patient,
we're going to, I'll get to you. We're going to rebuild your microbiome. Here's what I want you to do. When you go shopping, you buy your vegetables, always buy organic, but buy every root vegetable that's there. Every single root vegetable. Get turnips, parsnips, rutabaga, sweet potatoes, carrots. And every day you're going to have at least one root vegetable, every day. And you're going to go on Google, you go to that great library in the sky, Google, and type in list of prebiotic foods and print it out. That goes on your refrigerator. And every day you have one root vegetable and 2 prebiotic foods from the list on your refrigerator. Every day. Because they feed the good bacteria in your gut. You've got to give them the good food. And you can supplement temporarily while you're building up a healthy microbiome, but you don't want to depend on the supplements. So I want you to use these supplements for 3 months. I usually say 2 to 3 months. And then we're going to recheck and make sure, because our goal is diversity. So the root vegetables, the list of prebiotic foods, and then buy 5 different fermented vegetables, always non-pasteurized, and keep them in the refrigerator. Every day, I want you to have a forkful of a different fermented vegetable. Why? Because the fermentation process produces thousands of different species of good bacteria. And you're inoculating your gut with good bacteria every time you eat fermented vegetables. So every day you're going to have a forkful. Well, why can't they have 2? Give them 2. I don't know, I just made it up. I made up a forkful. I'm going to be happy if they get in the habit of it. And yes, sir.
Yeah, I'm a cardiologist, so I do a lot of chemo levels. Now that question what I was thinking was hard, I was kind of standing on the cardio IQ. Now most of the levels is a blood test. And most of the levels that I see, and I do a lot, are negative. They're not elevated. The question is, you're not talking about blood, you're talking about looking at the microbiome itself. Is that right? I want to make sure I get it straight.
No, I was talking about blood for the screen. And if they've got elevated serum levels, then you absolutely have to dive into the microbiome.
I'm just surprised I don't see more elevated levels.
Yeah, that's really interesting. I've not done that many yet. I've only done 4 or 5, and I think we've had 2. They came back.
And what test you prefer for checking with microbiome, specifically for TMO?
I don't know how to check TMO or TMA in the microbiome. I don't know how to do that. I don't know if there's a lab that's doing that. Okay. Yes, please. Yeah.
If there is
I'm coming over on your side of the room now. So embrace you guys.
Say goodbye.
Yes, say goodbye.
If there is dysbiosis in the gut, then is it a good idea to be eating prebiotics?
If there's dysbiosis in the gut, it's a good idea to give prebiotics. Should be. And always you have to observe, the results. And you may have to baby step them up. I don't have much problem with prebiotics at all. I sometimes have problems with fermented vegetables, that they can cause a lot of upset if they've got SIBO. And so, Mrs. Patient, just put your spoon into the fermented vegetables and put a little bit of that, put that spoonful of juice in your salad dressing. That's all you take. And then next week, just have a few threads with the spoon in your salad dressing. The week after that, a few more threads, and just slowly build it up.
2 things. First of all, some of these prebiotics are high FODMAP, so it is difficult to digest those.
Yeah, good point.
So it's like finding those ones that you can digest in the root vegetables. So
My experience has been with Megaspore that I haven't had anyone have a reaction.
okay, that's good to know. And the other thing is, in answer to your question, GI map stool test under the phytomicrobiota, they have the bacteroides and the formicades. And if those are low, it means you need more prebiotics. So that's one way to get a stool test.
Right. And in answer to your question, there was a study that said people that had elevated TMA levels tended to have higher levels of Prevotella in a microbiome analysis. Yes?
You haven't said anything about EMS, so I wonder if just...
I didn't say anything about EMS?
Yeah.
EMS can cause autoimmunity.
And I mean, other than trying to protect oneself, I mean, how do you, it's like this invisible thing that's messing up our immune system that's fighting.
Yeah. How do we fight it?
Yeah.
1 hour a week to learn what to do. And the bottom line, as far as I know, Einstein said, the problems we've created today cannot be solved with the same level of thinking that created the problem. None of us are going to change how we think. Very, very unlikely. It's the next generation. We have to protect their brains so they can think outside the box. That's the kicker here. That's the only way I know to save the planet, is to protect the brains of the next generation. So moms-to-be have to get the phthalates out of their system. They have to detox their breasts before they get pregnant, get all that toxic crap out of there that's been accumulating for 25 or 30 years to protect their future baby's brain. And we have time probably for 2 more questions. Yes?
What tests do you like to run for the microbiome?
For the microbiome, we use GI maps
Okay.
most often, I think. Yes?
And what about food sensitivity testing?
Food sensitivity, the Zoomers. There's nothing like the corn Zoomer, wheat Zoomer, dairy Zoomer, lectin Zoomer, peanut Zoomer, egg Zoomer, soy Zoomer, because there are so many peptides of poorly digested soy. If you're doing a blood test for IgG or IgA for soy, that's like saying wheat. Well, wait, what about alpha-gliadin? Because many people will be negative sensitivity to wheat, but they're positive to glutenins, high molecular weight glutenins, or low molecular weight glutenins, or gluteomorphins, or the FODMAPs. It'll just depend. And so there's nothing like the Zoomers. There's never been anything like those tests before. Okay, folks, thank you all so very much. Real pleasure to be with you.